Good afternoon, everyone, and welcome to another IFC webinar series. Today featuring ESO Fire Service Index, what it is and how to use it. And we have a great presenter today, and I'm really thrilled to be here with our presenter, who I'll introduce in a few seconds. But before we begin, the IFC is using and broadcasting using voice over internet protocol technology through your computer speaker headsets. Please make sure that your speakers or headsets are turned up and the volume is at the highest point so you can hear clearly our presenter's information. Audience microphones have been muted throughout the presentation. If you're experiencing any technical difficulties today, please contact IAFC support. And you can do that through the webinar's email link, or you can type in the chat function, and we'll do our best to get you hooked in and answer any questions throughout. And I'll be monitoring the chat and the Q&A throughout today's presentation. Please use that function. And as we moved into the chat and Q&A, we'll also be providing some handouts at the end of the presentation. So this recording will also be available probably within 10 or 30 minutes of the end of the conclusion. And we're excited to be part of this great information. Today, our sponsor is ESO. ESO offers an integrated suite of software products for EMS agencies, fire departments, and hospitals that are transforming the way first responders collect, share, report, analyze critical information to improve community health and safety. And you can learn more at ESO.com. And this is an in-partnership activity with ESO and the IAFC. And today I'm going to introduce your presenter for today, and it's Bill Gardner, who's a Senior Director of Fire Service at ESO. Bill began his firefighting career in 1985, working at various fire emergency management and fire medical departments. He is recognized twice as Paramedic of the Year in 1999 and 2001 by Austin Travis County EMS. Chief Gardner served as the president of Texas State Firefighters and Fire Marshals Association. He is currently serves also as the SFFMA as chairman of the legislative committee, and Chief Gardner is retired in 2019 as the fire chief in Linder, Texas. After retiring, he returned as a volunteer, serving as the role of senior advisor to the chief's office. He enjoys spending his time with his wife and his two daughters, and we are excited to have Bill here today. And it's just a great opportunity, again, to be able to share some real great stuff. So I'm going to turn it over to Bill, and Bill, it's yours, and I'll be following the chat for you, sir.
Thanks, Richard. Man, it is great to be here today. It's ironic to be here with you, brother, because both of us, with our desire for research data and the things we get to do, it's just really a great opportunity. One of the things we always start out with and talk about at ESO is truly our mission. And this is really reflective of what our mission is at ESO. And it's taking data, putting it in our people's hands so they can make sure that they're improving the community health and safety and using the power of that data to do those things. And when we talk about improving that community health and safety, we're talking about doing that for not just your community, but internally in your organizations. So this is really a great opportunity for us to share with you and talk with you about some data and looking at it. You're going to get the ability for this QR to be in your handouts. We're also going to make sure we share this presentation with everyone so you can look at that, pull this down, and pull this report down. What we do with this report and share this information is truly about giving you as an agency the ability to look at what the global snapshot is and what does that look like across the fire service through a collective. And we have the ability to do that. We're very fortunate that we have a significant number of fire agencies that have committed to be part of our data collaborative where that information is there and gives us the ability to look at that in a real-time snapshot where we know sometimes the ability to get data and to get that data is slowed down by process and collection and getting it into the hands of getting it to the hands of the researchers to do some things with. So The agenda, we're going to talk about what are the most common response types overall among fire calls, those type of items that are driven by the data. We're going to compare some EMS to fire type responses. We're also going to look at, for fire calls, what's the most common property type? Where do we respond and what are we doing at those responses? We're going to look at both some property loss that was reported. More importantly, we're going to look at some property risk that was involved in that loss. And then we're going to look at times. One of the things that we know and understand in the fire service today is that in modern construction, in the time of things being built in a more manufactured compressed process, it gives fire the ability to impact that quicker. We also know that items in the home compared to when I started my career back 35 years ago are different. The ability of the heat that's created, the things that cause fire reaction to impact the structure, impact the ability for life safety of both the residents and the firefighters changes very quickly. So we have some times we want to look at and see how we look like we're doing overall. And then a hot topic that we've talked about is uh, firefighters from working fires, what they're exposed to at those fires, and how we're handling and addressing decon and looking at the ability to at least start addressing on scene how to separate our firefighters from some of the things they're exposed to that's leading to what we know is an increase in cancer and the men and women that are out on the line out there every day taking care of us. So here's a little background about how we address this and how we walk through this. This index is a retrospective look at some aggregated data from January 1st through December 31st, 2021. It's about, it's a little over 3.2 million records that have come from 624 agencies to participate in our research consortium research group that provide this data. Perspective, we've reviewed about 5% of the total working fires in that occur in the U.S. This is a really solid benchmark for us to keep moving forward. Uh, so we see about 24,000 departments that are in the U.S. We know that. We sample about 3% today, with that being able to grow and sample by 30% in the next 2 years because we've doubled the number of people that have already agreed to participate in the data consortium. We've doubled the number of people that are wanting to share this data because we all know the value of this information. And this is a quick comparative. We know that most data is about 3 years behind by the time it goes in to the system. Some of it goes to the states. The U.S. Fire Administration gets it. NFPA works with U.S. Fire Administration to look at that. And they have great people. Uh, the folks there, both at U.S. Fire Administration and NFPA, they're doing research that are working in these things are friends of mine. I appreciate they're doing it. And their struggle is they're having to wait for that data. So this is a quick snapshot that we can use while we wait for that data to get to U.S. Fire Administration, get their ability to do that and work through that. So that's how the data comes back. It also, the data set is established by standardized data. So the ability to compare this data, because it's standardized and used, compares very well. It doesn't allow for data to be misinterpreted because someone calls a structure fire one thing in this area and it's called something else different because of the way it's set and established. The ability for the data to be compared and be doable in this process. So, what's burning? Let's just start out and look at what we do. We know that out of the number of responses we do, actual fires are actually something that is burning is a smaller percentage of the total number all of our calls. But when we look at that, that's about 72,000 out of the 3.2 million calls. There's actually something was burning. There was a working event there. We looked at those, and you walk through, and about 32% of that is in a structure fire. 25% of that is outside fires, outside rubbish fires. 19% of that is natural vegetation, and then 16% of that is mobile property, vehicle fires, associated heavy equipment fires, those things associated with that. One of the things then is 8% collect all. One of the items that we know is that we have fire in a lot of unique places, a lot of different items. So this is where we know that we have things burning. And this is where we look at how to address what those types are. We know that one of the most dangerous things that occurs is fires. And we know, though, it is one of the least frequent items that we go to in those things. One of the items that's more frequent that we go to, that we address and have spend time with, is MS related calls. And so we have done the fire index, this comparatives for a couple of years now. So it gives us the ability to trend some of that data to see what it looks like today compared to what it looks like uh, a year ago, 2 years ago. And so here's some of that comparative. We know that out of some records looking at the events, about 3 million of those actually were able to be tied down to and identified into EMS related events. So 69% of our calls are EMS related calls. That's pretty standard. That was in 21, and comparative to 2020, it was about 69%, with 2% of our calls fire based and 3% of our calls were fire based in 2020. So that's pretty standard in what we're doing. One of the things that we do talk about a little bit in our EMS index that's also available for you is, while the percentage of numbers has stayed the same, what we're actually doing in some of those EMS based incidents is changing. We know that healthcare has changed. We know that what we're doing and our men and women on the street that are deployed out on EMS related events have changed to some significant items. Not everything is 911 transport items, such as when we first had EMS brought into the fire service. Some of those things are now EMS response for assessment and referral to alternative care, EMS assess and treat on scene with community-based paramedicine, or the ability for people on scene to assess and look at a person and have an expanded scope. We also know that we've integrated not just paramedics into the EMS response world coming from fire departments, but we also have the ability to know that we have physician assistants, nurse practitioners that are tied in to EMS agencies across the country that are going out, that are doing treat release right there. They may be prescribing antibiotics, may be doing suturing, they may be doing different assessments and referring that patient out. So the EMS numbers are pretty steady. What's different is what we're actually doing. We also see today a growing trend for EMS response, and we know the changes that are coming with uh, healthcare as a whole and how funding is changing with the healthcare system as we know it, and both in reimbursement for us as providers. So when you look at those and you look at that number and you see where we are, the ability for our people to go out, respond, make an assessment, make a decision, and then refer that into potentially a telehealth event where they have the patient never leaves the home. We connect them to the right resource. We have the ability to connect the people that in our EMS responses to resources that help address their needs for, it may be medication related. We give them the resource to do that. We know that we have senior adults and people that live in environments where their number one need is food and support, and the ability for EMS to be called as their primary health care. We've increased our tools to provide them the ability to get real results. Real result isn't always a transport to the emergency room or to a facility. This provides tools for that, and we're seeing more and more of that done in delivery models throughout fire departments throughout the country. And I think that's really a growing piece where we're going to see changes. I think as we move forward in data collection in the fire service and we see different things, we're going to see a breakdown in what we consider and how we collect EMS calls. We know that there's a discussion from the U.S. Fire Administration that we feel like is really important for our industry and how we collect certain pieces of data. We know that U.S. Fire Administration is working with NIMSA and working with NHCS to look at all of those things about what are we collecting data-wise compared to what we're doing and making sure it's truly reflective of what's taking place. So I encourage you while we walk through some items in the remainder of our fire index to also look at our EMS index and see what's taking place there. There's an interesting piece in that EMS index about ketamine. We all know that that has been a hot topic of discussion about scope, care, delivery of certain medications, especially ketamine by pre-hospital care providers, and interpretation of that from different pieces up to and including different legislative items that were brought forward. So look at that also. Those of you that have EMS as part of your organization, today's fire service, there's very few of us out there that would not have either at least a first response piece, if not a complete EMS transport piece, or at least have modified piece where it's not EMS transport, but we may be the connection piece to social services through our community risk reduction and outreach groups. So take a look at that, and that'll provide you some great information there also. Let's talk about structure fires and talk about what's really been some interesting things there. We talked about when we looked at where fires were and where structure fires were. We look at the property amongst those in the building fires, and we see and the breakdown of the different incidents, and you see the different types where it's breaking down. And you look at where the most common locations are, and you start looking at the residential percentage of our fires. And that's always been the case comparatively to where we are in commercial buildings, compared to where we are in educational facilities, compared to where we are in other building types. We know it has been residential. We know that we're there. But the number that we have in residential, the 400 series, the structure fires that are residential, truly show with the data that should be a focus that we're dealing with across the board with the fire service today. We should be looking at and trying to decide how do we do a better job of preparing our people in their homes for fires, knowing what we referred to earlier with the fire spread rates because of furnishings in homes, because we also know the number of people in a residence is increased. When we look at across the country where we had people during the last several years where they may have been only 2 or 3 people, we know that we're now getting demographic information that we may have older people living in the homes with family. We have younger people that have come back home and living with their families. So the number of people in these residences is increased, and that's also changed our ability to say, hey, we need to be better prepared for what's taking place. We need to be better prepared to help educate them to have early notification, early approach to get out of the homes. Do they have working smoke detectors? Do they have all the things necessary to be better prepared to get out of the home so that we can make sure that they're okay? Another part of that, when you look at where fires are, a lot of our risk reduction programs haven't always been targeted there as well as we should. We have some annual items during Fire Prevention Week, and we talk about having an exit plan in your home. We talk about changing your batteries. All of those are critical. But honestly, we really routinely work through our inspections and our maintenance of inspections and our permitting and working through those processes are targeted at commercial businesses, mercantile, all of the hotels, certain Residential property that could be classified in those, such as apartments or multifamily, get some attention. But what's really interesting with all of those is those environments also have code requiring that certain things be done. So you have to look at, are we as progressed in addressing where our fires are occurring as we need to be in our preventive education processes? And not just education alone, but where are we in our residential building codes? And are we using data to help drive the results we want from that? Where are we in making sure that we are looking at products that are being done in our communities that are being used for construction? Is that the products that we want to drive? Because we have data saying that this is where the fires are going to occur. How many of you deal with and have discussion about setbacks? How many of you deal and look at row housing and the ability for what the separation pieces are in those in firewalls and construction materials? All of those things are critical that we have to become more active in educating the community to be looking for those things, educating the property owners that have rental property on how they can help take care of these customers. All of these things are critical in what we need to be doing. And all of these things drive to what we should be looking at to help address the fires in the homes where things are taking place. Here's a really interesting factor that we looked at and started walking back through and then started looking at a little more data that compared through. Uh, Residential properties accounted for 80% of all the fire calls. That is a significant increase from 42% in 2020. And what that looked at, and we started looking, and first we looked at the data to make sure there wasn't some mistakes in the data. Did we have a problem? And the data was good. It was confirmed. It was verified. It was extremely high percentage of accuracy. And then we started looking at what happened during this time to us as a country. Where did the people go? One of the factors that is in a fire is the human factor. And that factor became very clear and was noted in the process of a lot of things. And that became a part of what we looked at in fires. And to look at the human factor, you have to look at where the people are. And what we found is during the times of COVID, we had people back at home. People that routinely were in offices, out and about, that were working, that were in schools, in different places. They were moved, working from home. Their families were home. Everything had shifted to a new environment. We looked at that data, and we're still digging through a couple of pieces of that because it became very interesting data. We started looking at the time frame in which these fires were taking place. And we were looking at, okay, they're in the residence, people have moved back in. What's the time frame? And what we noticed was that a percentage of the fires that took place increased dramatically during the daytime, from late morning, like 11 to 1:30 or 2 in the day. And we started looking at what is taking place and why is there such a fire increase here? And then we started looking at that. We actually did some text search of some of the narratives, and we started looking at some of the indicators of location of the fire and some of those things. And there were an increase in location related to this study was related into kitchen fires. And then it started making sense. We have taken a group of people that have had a normal routine, that have been about working in an office, a warehouse, a school, any of those places, and we've moved them into their home. And then, quite honestly, we put them in the environment we're in today. We put them on a camera with all of their teams working. And then we said, hey, keep working and do these things. And they're trying to balance what they're doing and their work and the kitchen fires are occurring during the times of lunch. So we put people in homes, had them work, be on camera, trying to balance those things, and we increased our kitchen fires because of some of those things. That's a really good piece of data for us as fire departments to know. Now we have the ability to go and say, hey, we had this significant increase. We need to make sure that we're talking to people about, are you paying attention? Are you being aware of what's happening? Are you being aware when you're using the toaster oven? Are you putting something on the stove? Are you putting something to warm in the oven? What are you doing here at your lunchtime? And are you paying attention to it? Are you controlling these things? You know, the smoke detector is not the indicator when it's done. It's a warning. So don't follow those traps that way. It is how to educate them to decrease this and prevent more of these fires where that's taking place. And honestly, a lot of us haven't targeted that type of concept in our prevention and risk reduction. This data gives us the ability to go target that. This data gives us the ability to look at multifamily residents and go, hey, maybe we want to work with our multifamilies to put some type of systems in their kitchens. Doesn't have to be a complete suppression system underneath the hood, but maybe a small system, maybe a can system that automatically goes off and the powder solves the fire. Maybe the ability to make sure that everyone has visibility on their meals while they're cooking them. Maybe the understanding of take the time to do this and don't try to multitask to get some of these things done. All of those things have been indicators of what we need to help address to decrease this. This is a significant increase of those, and we need to help prevent those things and direct what we're doing back to those environments. So this gives us a really great opportunity to take the data and make our communities safer, make our responders safer, because we talked about if these fires are here, they're taking place in the home. We know that the residents, the way they're designed, the built, the construction, all of them have factors that are not always in the firefighter's favor. The ability to make sure that our customers who are living in those homes are safe. We know that some of the byproducts of the fire are very deadly to them before the fire even gets to them, before the gases get to them, before some of the smoke gets to them. All of those things lead to our ability to make sure we're providing them information to help resolve where we are in these type of numbers. I'll even say the other thing is this may be a great topic in discussion for us to go back to and look at where are we in our discussions in our local communities in our states about residential sprinklers. That is a difficult task. There's a lot of discussion points about cost, availability. What does that do? Where does that restructure their funding? Does that make the ability for someone that's getting a home unable to get a home? All of those are factors that have been discussed. The piece of it that I would add to that is making sure that we take the ability to say, hey, these are where the fires are happening. We know that sprinklers have a significant impact on someone's ability to survive a fire. We know that it has the ability to have an impact on decreasing the amount of loss. That's why we put it in multifamilies. That's why we put it in commercial buildings. That's why it's in schools that are being built today. That's why those things are there to protect those lives. So this may be a piece of data that becomes important for us to look at and go, hey, this is where the fires are happening. They may need the same protection. And, looking at some of the codes associated with that, with, R13 may be an ideal code over some of the other more extensive codes. So these are things to take back to your community. This is an item for you to compare and run your numbers against. Your numbers may not match this. I did the same, but it may show an increase in your community that would help explain your needs and what you need to do also. Then let's look at some of the numbers. Let's look at where we are. One of the things that we know is estimates are estimates. The ability to always calculate really good numbers based off of what is there and basing that on what the insurance companies are also valuing and looking at compared to a home value from an appraisal may not match necessarily the value that it is looked at and comparative from the insurance companies. So keeping those things in mind. Also, looking at values of what replacement cost is to do estimate versus what the loss was. So all of those things play a factor. But all of that said, looking at what was the loss compared to the overall loss of the total estimated value, and then looking at the ability to say, hey, this was the content and this was the total estimated content values, tells us that we may not be doing as well on the content as we should be. And that we need to figure that out. And one of the things that I encourage everyone to do is have the discussion internally in your organization about how are we going to manage those estimates. IFC has a very defined process to how to calculate and look at your property value and then how to apply percentage of fire to that loss. The ability to look at content value based on discussions with insurance companies is a great way to get that and update those values as you go forward. As you look at this and you look at the data, we're not doing a bad job in comparative to where the loss is compared to the property value. When you look at the property loss of about $713 million, when there was $1.3 billion on the line, guess what? It's not bad. Can we do better? Could we change that? Absolutely. And that's the desire of every fire department in the country is we want to do better. We want to make those opportunities better. I think there's two things that help us do this better is in your organization defining the policy and how you want that to be done and documented. The second is realize that value is up. The estimated value compared to in structures and buildings and properties is significantly higher across the country than it ever has been. So that means that loss will be higher. But it also means that if our property loss is sitting where it is, that means we're in a aggressive attempt to stop fire and stop fire spread. So that's an important factor for us. It is an item that I think we're winning most of the battles, but we could do much better to get us to a really much more balanced approach in both the data collection, but also in showing our approach and value in how we are truly improving the risk that was there and showing what we saved in that. So that's another piece there. So looking at the comparative between the two and looking at 2021 compared to 2020, two things were there. We know that there were some cost adjustments in the values, but also we saw a significant increase in where that dollar loss was. That also makes me and compare and make me ask the question. We saw a significant increase in the loss, but we also saw a significant change in where the fires were. So do those two have a correlation? They both occurred at the same time. They both had the same issue associated with that. When you look at this, you can make a reasonable assessment that says because we are having more fires in residence, we are having more property loss. Now, that may be because of location, uh, uh, any uh, ability for us to get to someplace in a timely manner, the ability for us to have enough resources. We know in today's environment the ability for us to have adequate resources, stations, trucks, staffing, all of those things are becoming more and more difficult. So that may have played a factor. But the one known is we changed the location where the fires were. We had more fires in the home. We now in turn have had more loss in comparative to dollars and cents. We need to really look at what can we do to improve that and how do we get to change uh, what we're doing? How do we get to change how we're addressing those things? And this is the time for us as the fire service to come together. We have great support at the national level. We have great fire marshals across the country and each one of the state levels. They're looking at the data. They're looking at the information. Uh, any ability for us to say, here's the problem, and provide real time information gives us the ability to walk back in and go, hey, we need to discuss what may be taking place. The other part of it is we may have been getting better at documenting what the loss is. We may have been unable to document significantly in 2020. We may have not paid it as much attention, but it's almost a double in that loss. So I don't know that we didn't document in the fire service as, as poorly as that would be the cause. So we have to look at where those fires change. We have to look at where the loss is, and we have to figure out our way to address that and make those adjustments. Here's another item that we looked at. We talked about this early on about fire spread, the ability to get there, the ability to make improvement because we know time helps eliminate fire spread. We also know that there's certain things that we can't control. The distance from where we are to the fire, we can't change. The ability for us to make sure that we travel safely should be the priority over the amount of minutes and time that we have. So all of those things are certain items that we get to look at, but we have to remember it's difficult to change that. So when you look at where we are in the call processing time from the call to assistance to arrival is alarm handling time was reported there to be in within norm, but it's not always a mandatory reporting field for certain agencies. So statistically, we did not have significant amount of data to talk about. The other part of it is dispatch, and we looked at where we were in the dispatch time and for the median and the 90th percentile, and we're doing well. We seem to be doing well from when our fire dispatch centers have the information to getting us notified. We seem to be doing very well of getting that information and getting that to our responders. When you look at turnout time and you look at where we are and you look at the median and you compare that to where the NFPA benchmark is, you look at where we were in the 90th percentile, we weren't perfect. We weren't always on target, but we also realized that that slight increase may be due to changes in our fire service deployment models. We know over the past year that we've had increased responsibilities during the COVID times. We've also had increased responsibilities of taking care of the health and safety of our responders. And that's led to not always having the same number of staff every shift. It's also left at our volunteer agencies having gaps of people that can't be available. So all of those things have led to some of these impacts where we're going. When you look across there, you look at the median, you look at the 90th percentile, Some of those have some outliers that we took out, uh, those that had significant multi-day uh, travel times or response times because of deployments, because of support. We took those out. Those weren't truly reflective of where this was. So when you look at those things, we've had increases. We had increases over the year, but they weren't significant increases. We were not at a point where we had triple times to be and where we were getting places. We weren't at a point where we had times where we just didn't get to someplace. What we had was some increases, but I think those increases need to be evaluated by each one of us individually in our organization and go, is this just a, a 1 year event or is this a trend where we're having these increases? Are we having increases because of changes in where our traffic flow has been? When we talk about we're going into residential areas, areas that routinely didn't have as much traffic, they may have more traffic now. There's more people there. Areas that we may have also looked at that had resources that were uh, spread out more, we know that those areas are struggling to recruit people. So all of those things are becoming a factor. It is an item that I truly believe that we should watch and keep our eyes on over the next several years because we need to see uh, the approach to where does this grow? Is this growing? Are we able uh, to make sure if it's growing to start answering the questions? So this is a good comparative and a good start for us today, but we in the fire service need to be aware and watch what those impacts may be having on our ability to deliver service. Here's the other item. The next piece that we looked at is in our system, we have the ability to track and look at the number of firefighters that went to the incident, that were exposed at the incident, and then absolutely following what they were exposed to, what they did for decon. And that's done at the individual firefighter level based on each one of the units at the incident. And they have the ability to fill that out right then. It's not a separate item they have to go do. It's not a separate piece that they have to go through. We looked at this information and we were kind of excited when we looked at it at first. And now we're doing a separate study that we'll release in the spring that we're going to talk with, and it's going to a peer review about how many of these people hit best practice. What this tells us is that out of a fire that was classified as a working fire, that we had the firefighters actually document that they were exposed to a list of items from some of it could be foam, some of it smoke, some of it heat, some of it was byproducts of the fire. What a long list of those items they were exposed to, the PPE that they were using to protect themselves at that time of exposure, and then what did they do following that while on the fire ground to protect themselves and decon that process? Did they go through and did they do a wet decon, a dry decon? Did they do brushing? Did they use wipes after they did that? Did they bag their gear up at the incident so that it didn't off gas with them back in the unit? Did they have the gear in the cab or did they have it out of the cab when they went back? All of those things were tracked. 80%, 86% of the time, we know that there was at least the people that documented that had an exposure, they did at least one item. That tells us that they know that there's something that needs to be done. 14% of them didn't document something, and that could be a documentation item, or it could be, you know what, we were exposed to this, we just didn't think it was a big deal. What we don't know, and what the next stage of the next report is going to reveal to us, is hey, how many of them went to the next level? They didn't just take and wipe their hands, they didn't just hose themselves off. They actually followed the best practices from the Lavender Report, looking at what we could do while on the scene prior to getting back to our station to be able to change out our gear, be able to shower, be able to do those things that we also know are the next steps. How many of those things were being done? We're going to release that information in April, following some peer review of that data. This is a great item for you to look at in your agencies today. How many of your people, after you've had an identified working fire, are taking the time to take care of themselves? And how many of you have it built into your operating procedures and guidelines that says, hey, we understand we may be on the scene a little longer. We understand there's some things, but we want to take care of you. Our people that are fighting these fires, the men and women that are doing that, are the most critical, vital resource we have in the fire service today. We've got to take care of them. We know from the items that are taking place from researchers around the country that they're being exposed to these products that are increasing their risk to get a cancer and illness that unfortunately in a lot of our firefighters is leading to their death. We've got to prevent that as much as possible. We've got to step in. We've got to make those interventions. Create those steps in your operating guidelines that says, hey, you did this at the fire. Before you clear the scene, before we start doing X, Y, Z, I want you to follow these procedures, these steps. Hey, when you're coming out, we may still have an active fire incident going on, but when you go to rehab, I want you to do at least these things to help mitigate the exposures in those events. Look at your numbers. Look at how well it's being documented to take care of your people. Look at the numbers to see how well your people are being able to say, we did the right thing. We have taken care of ourselves. There's a lot of people that have looked at, and we've had the opportunity to work with folks and help agencies with providing some data and helping them deal with employees that have had illnesses that have been part of an exposure to something that they got in their job. And the belief was, well, presumptive law automatically covers no matter what. Presumptive law is a good opportunity, and every one of us should fight to make sure there is presumptive law to help protect our people. But even then, there's going to be questions asked about, hey, can you show that you were doing this? And the ability to say, yes, I was at this fire at this time, and here's all the fires I was at, here's all the gear that I wore, and here's all the things I did to help protect myself, is critical in getting that next step of saying, hey, here we go. We've addressed these things to take care of ourselves. We did what we could. Unfortunate pieces of the job have come and impacted us. We need you to take care of us as we have taken care of you over the years. So look at this, work with your people, help them feel comfortable answering those questions, and make sure that they're doing those things because we want to take care of them. So I've gone through some points. You're going to get this data. You're going to get the opportunity to look at these things. You get the opportunity to take these index that we're going to send you. Look at this data. Compare it to your organization. We always talk about we want to do better in the fire service. And those of us been in the fire service, we know the level of opportunity for improvement so we can say we were better than this shift or that shift has always been there. This is the same thing for them. Give them the ability to look at what's taking place in their world. Give them the data that says, hey, this is what's going on your shift. Hey, this is what's going on in your division. Hey, this is what's going on here. And then look at that and go, hey, I've got 3 neighboring cities that are very similar in size. We have the same deployment. We have the same things. Let's look at this and see how we're doing. And if somebody's sitting there going, hey, look at this, our numbers are great. What program do you have? How did you do that? and would you share that with us? So, Richard,
Yeah, this is
I'll
some great
open it
information.
up.
I've been trying to promote some questions, and I know you and I chatted earlier about some of the key things that we think are making these changes, and I think it's well worth repeating and looking again at the fire incident rate with residential structures, and with the efforts at the United States Fire Administration to update the NIFERS program, and how best to get more real-time data to make us much more reflexive, and responsive to the data needs. So that's a critical piece of information that you've collected, and we think that's kind of important for us to get a snapshot of what's going on out there. But one of the questions that I really want to dive into a little bit is the fire loss calculator. And you and I have talked about this before, about how that's done, who does it. We know it's in the NIFERS system that you collect. You make that initial estimate, but I'm a company officer. How do I know that it's 20,000, 30,000, or $100,000 damage? When does the fire marshal, take the next step? How do we interact with the insurance company that paid the final bill, to really give that actual estimate? And are you interlinking your data with your real estate assessors in your community to really get a good snapshot of all the pieces of that valuable data, to make those estimates? Because I think that's a big piece to really looking at that. And having worked in the fire marshal's office for an extended time, that's always one of those lessons you learn, to go and gather the data and then provide that back to the fire chief as support.
I think one of the items that is critical to that, and you said it, is the ability to realize some of that data may not be there day one, and it may have to be zero, and it may have to be not complete yet. We have to get comfortable with that, with the company officers doing that, knowing that the prevention staff is going to come back in and adjust that. One of the things that we've done, because we know that's probably the best way to do that, is anytime that you update that, we automatically update that to the inverse, because we're never going to get the real numbers. You and I both know that, being in prevention, both of us in a point in time in our career, until we get the insurance adjuster on the site and he makes a decision, and then we find out what they had their discussion with the company and what they're going to actually do. I think a couple of things. One is, everybody's market is different. Remember what your market is, and remember the ability to look at those things through assessment, or the ability to look at the IFC calculator. The IFC puts a home calculator that allows you to put, based off of what your market is, the cost per square foot into that calculator and run that, so you have that. One of the things that is really promising that's taking place, that we have the ability to deal with right now, is we're working with uh, one of the insurance underwriter groups in the country, has come back in and went, maybe the current way of looking at all of the associated cost for fire and how we've been rating this may not be correct. And they've sat down with a group of stakeholders, and I've been honored to be able to sit with them as we walk through, what does that look like? And this question's come up multiple times: is what is lost value, and what is truly the potential loss, which is the bigger piece that we should be reporting on. Is this was the potential, and look what we did. And we've had that discussion, and making them aware that the insurance company needs to be is comfortable giving us information back as we are giving them. And that's not always the case.
No, that's a good point, and not everyone's aware of. Some states have the Arson Immunity Act, which allows for that sharing of information. Some insurance companies have it protected. It really depends on what state you're in. So again, understanding those components, and then the extraneous pieces to this, of the cost of a kitchen fire. Okay, it's $5,000, but the people had to move out of their home. They had to go rent be put up in a hotel, and maybe Red Cross has supported them for a short period of time, but then there's a long-term cost. So there's other costs that really do come into the true impact of that incident that's out there. I know we're getting a little tight on time, but I want another question I wanted to really look at and expand on. You talked about the data collection of time, of dispatch time, the reflex time, for actions, and you and I talked about getting water on the incident, and one of the projects that's out there, and I'll say sorry to hear that Don Abbott passed away recently here. Great loss to the fire service. But Don's Mayday project really took that step, that data, the next step in analyzing the Mayday incidents and looking at when they were occurring on those incidents. And, and his reports obviously showed that they were occurring after midnight and with, extended shift periods and such. But again, it's the data that helps support that analysis. So, again, why it's so important to have all that information, into your system.
So those are great points. Thank you. One of that is we've had that and the ability to do those. So you'll start seeing from time of arrival to time of water coming in some of our index reports, because we've been capturing that. I had to capture it for a little over a year to make sure that we were getting good data and we were getting consistent with that. We've got good data now, so we're going to start adding that in to see. We always talk about we were great at telling you when we got to the curb. We weren't always really good after we got to the curb. So we have that ability to start reporting that. We are actually in discussion the same way we were with some of the other groups about capturing the exposure and the cancer data. We're in that discussion of, if we put all of this data together, putting that near miss information, that Mayday information, that rescue information into the same report, so we're not chasing it three different places. So those are things that we're working through today. We can talk more about those in person with folks as they see us. I'll be out at Clearwater. I don't know who all is going to be out there, but we'll be out there at Symposium in the Sun with the Volunteer Combination Group. We'll be out there. We'll also be, I'm going to be headed over to Murfreesboro and absolutely be at FRI, but a bunch of places in between those things, so we can talk with you guys about this and talk with you about our we've learned that the more we put with the agency to say, hey, we'd like for them to capture this, and we standardize it instead of making it some custom things that we can't compare, we're getting the ability to do those data, and I think we're all going to end up in a better spot.
No, that's really critical, and we're really appreciative that you're going to be available for all these conferences, because I think it does give you the one-on-one conversation opportunity with the people that are doing the data entry, and that's really critical, and making it easier. And we all know how critical it is to capture some of this, and that we need to do a much better job as an industry to continue that. So again, we're very, very appreciative of all your support of this. And those are the four current ones, and not including VCOS Symposium, which is next week in Clearwater. And that's a great opportunity for any chief line officer to attend and really interact with other responders that are dealing with these type of questions every day. And certainly with the volunteer combination officers section, they really want to get more people engaged and truly understand that as our fire service continues to grow around the country. Again, I want to remind everyone that this is a recorded survey. And you'll get a survey at the end here to kind of tell us about what we did. But also in the handouts, if you go to the top of your screen, there's a little handout tab. Please feel free to click in there, download those handouts. Bill's put a great little group of information together there from ESO that can do that. If you have any questions that you'd like to ask and didn't ask yet, please don't, feel free to send those in to Bill or I, and we will make sure that they get answered. And Bill and I probably chat a half dozen times, a year to on these specific topics. So we like to keep that information flowing. And there's lots of other special subjects out there that we're looking for data on. Probably the biggest one that occurred recently was the COVID national study that went through NIFERS, and that was one of the first national type studies to look at that, and that really helped get you funding. So that's an important piece to what we're doing. Bill, I'm going to give you the last word as we sort of wrap up today.
This is one of the most exciting times in the fire service. Be proud to be part of the fire service today because we are moving forward. The support we have at the federal level, the state level, groups like the iChiefs is making that important. I appreciate our partnership. Everyone, please be safe out.
Thank you, Bill, and thank you, CSO, for sponsoring this great event. And that concludes our special presentation on data, and we look forward to the next opportunity to interact with you all. Have a great day. Bill, good luck.
Take care, Richard.